Hi, good morning, everyone. Thank you for joining. We will get started in just a moment. Okay, let's get started. Good morning. Happy Friday, everyone. My name is Karina Salinas, and I am the Diversity, Equity, and Inclusion Manager for TBWA World Health. And I'm so excited that we have the privilege to host this conversation this morning. This discussion will be recorded and it will live on YouTube, so you can always come back to this site and rewatch it if you want, or watch it the first time if you're just tuning in. We are so excited about this conversation. In 2020, our agency founded Black Health Now to raise awareness about discrepancies that impact the Black community disproportionately. And the idea was to start conversation and create programming that ultimately lead to action. And of course, we weren't the only effort with this focus or people with this focus. And today we are connecting with other Black activists and medical professionals who are also content creators about the work and the impact they're making outside of the traditional field of medicine. We are joined by Valerie, who has a master's in public health and is board certified psychiatric nurse practitioner with over 9 years of nursing experience working with individuals across the lifespan. Her treatment modalities include a combination of psychotherapy and psychopharmacology to create treatment plans that are patient-specific and provide services through telehealth. We are also joined by Dr. Alana. She is a clinical psychologist in the Autism Center at the Child Mind Institute. She has experience in addressing the complex needs of youth with neurodevelopmental differences and co-occurring psychiatric disorders and complex medical conditions. Thank you both so much for your time. I'm so excited to hear more about the work that you do in the medical field and also on social media. Our moderator today is Kirsten. She is a social media manager for TBWA World Health and is also a content creator. So she has a lot to relate with our incredible panelists. Feel free to engage throughout the comments and ask questions. We will have time at the end for Q&A. And with that, I'll hand it over to Kirsten.
Hi, everyone. As Karina said, my name is Kirsten Beach, and I am the social media community manager for TBWA World Health. And I'm so grateful for the opportunity to moderate such a great discussion with incredible Black healthcare professionals doing important work both within their professions and outside of them. Alana, Valerie, thank you so much for being a part of this. But before we jump into questions, I wanted to, open up the floor a little bit and ask if you could give us a little bit more insight into who you are, what you do, that sort of thing.
All right. Well, thank you so much for having us today. As mentioned, my name is Dr. Alana Telesford, and I'm a psychologist at the Child Mind Institute. My primary area of focus is in supporting youth with autism spectrum disorders, but also with other developmental disabilities or chronic medical conditions. And so as a psychologist, I wear a lot of hats. So my day-to-day looks different every day of the week. But broadly speaking, I do diagnostic evaluations for families who suspect that autism might be part of the picture for their child. I also do evaluations for families who already have diagnoses and just want an updated profile of what their child's strengths and needs are after receiving intervention. And then a lot of my role is in providing direct care. So I provide individual therapy to youth to manage big emotions, address picky eating. I also do some parent coaching so that parents also get some skills in how to understand their child and what their behaviors are trying to communicate. We also run a variety of social skills groups at my institution to address social communication needs. So all the skills that we know are important for making and keeping friends. And then, as I briefly mentioned, I also do some intervention for chronically picky eaters. And so when I'm not providing direct patient care or writing notes, I also have the privilege of being able to contribute to articles and social media content for the institution so that we can really provide some widespread knowledge about evidence-based care in mental health. And so I'm really excited to be here today. today and continue this discussion.
That's amazing. Thank you so much.
Wow, that was amazing. So good morning, everyone. My name is Valerie Revolus. I'm a health nurse practitioner. I currently work in private practice, primarily dealing with ADHD, depression, bipolar disorder, and anxiety disorders. I've been a nurse practitioner for the last year and a half now, but I've been in the mental health field for over 10 years. Currently, I do a lot of medication management and provide psychotherapy in the clinical practice that I work in. I work telehealth, so I work from home. And I guess my day-to-day looks like back-to-back clients all day, working from home, and really kind of just listening to people's problems, their traumas, making proper referrals, assessing to see whether medication management is warranted, and interacting with families to see what the next best steps might be and providing them with resources in the community.
Thank you so much for sharing. That's incredible. And like I said, I feel so lucky to be able to talk to you all about this and get a little bit more into this conversation. But with that being said, Alana, you said that Dr. Alana, you said that you wear a lot of hats within your role. And I kind of wanted to know when did you know that you wanted to work in healthcare? Because, it's a big decision. So what was your thought process behind that? And what did that look like?
Great question. The thought process wasn't specific. I feel like I always knew that I wanted to be some sort of helping professional ever since I was very young. And so when I was younger, a lot of the things that grownups told me was that I was very smart, that I was very patient, and that I was good with kids. And so as someone who didn't have a ton of exposure to mental health specifically, my immediate inclination was, okay, well, I'll go into healthcare and I will be a pediatrician. That makes the most sense. And so I started to kind of formulate everything I was doing around that ever since I was very young. And in high school, they make you take career aptitude tests. And I did not get pediatrician on my results. I got psychologist. And so I was like, great, I have a new direction. I didn't know anything about psychology besides what I saw in movies. I'd never met a psychologist. And so I said, okay, this sounds like a great career based on what the test says. I'm going to go for that. But then I started telling adults in my life that I wanted to be a psychologist, and they started to say, are you sure about that? I really think that you'd be better at being a doctor. There's a lot of downsides to being a psychologist. And being a teenager, I was like, of course, these adults know more than me. So I'm going to go back to the pediatrician gig. But then my junior year of college, I took a psychology class and just really became passionate about understanding differences in the way that we develop, and differences in the way that we express our emotions, and the ways that we make friends. And so I decided to shift back to the original plan of becoming a psychologist. So it kind of was there all along, but really became more solidified in college.
Wow. I mean, that's, I completely understand. I empathize with what you said about, the kind of the back and forth, and then you look to parents and you're like, what could I do? And then the way that looks. So, but that's amazing. And I know that the work that you're doing now, it's worth it. And the fact that you're in this field, it's so appreciated. And you're making a difference. Valerie, I wanted to ask you kind of like a similar thing, but what was the defining moment in your life that made it clear to you that you wanted to make a difference in the healthcare space for others that look like you? And also, what advice would you give someone who wants to get started in the healthcare space?
Okay, so it's two parts to my question. Okay. So in comparison to Alana, I was kind of not given a choice in terms of healthcare. I come from a family full of healthcare professionals. My mom is a nurse practitioner. My sister is a nurse in labor and delivery. My middle sister is OBGYN. So I kind of got exposed to healthcare really, really early on. Didn't quite really know if it was my passion or not, but as I kind of started getting into the field, I found a love for mental health, and I knew that's exactly where I was supposed to be. So in regards to a defining moment, I can't pinpoint one particular defining moment. I want to say it was more of a culmination of moments. So just to kind of give some background on me, I started my nursing career working in an inpatient geriatric mental health unit back in 2014, working in the underserved community. And what I quickly found was that a lot of my patients felt very misunderstood, felt like they weren't being heard, felt like the providers taking care of them really couldn't relate to them. And they just seemed to really open up to me really, really easily. So at that point, I kind of started noticing, I have kind of like the gift, or like I'm really good with this type of population. But I also felt like for me to have more of an impact, I needed a more autonomous role. So at that point, I kind of made a decision to go back to school and get my nurse practitioner degree. And in that space, I was trying to find other women of color who were psych NPs, and I couldn't find any. So that kind of was like, okay, well, that's a problem. And then also along that space and time, not to get heavy, but I had a friend of mine commit suicide, another friend of mine attempt suicide several times, both people of color. And what I also realized in that moment, it was really devastating, obviously, for everybody, but it was something that nobody spoke about. Literally, it was like on the hush. And I just really realized that there was just a lot of guilt and shame and stigma still really surrounding these type of things, especially within our community. So that was another kind of aha moment for me that I needed to be in this space. Fast forward to pandemic times, 2020, I'm in school for my nurse practitioner degree. And I think that people weren't really speaking about mental health prior to the pandemic. But when the pandemic happened, it was in your face. The rates of depression, suicide, alcohol, substance use, domestic violence was on the rise. And being that there's not that many women of color in this field, the people that did know me started reaching out to me. Hey, I have a friend. Hey, I know someone in my family that needs to talk to you. And they started reaching out to me more and more. And I guess that final defining moment that really kind of solidified I'm in the right place at the right time was when I started getting feedback from people saying, oh my God, you don't know how hard I searched to find someone who looked like me that could help me out with what I got going on. So I would say for me, culmination of events leading up to it, but pandemic time, I think when I started getting that kind of feedback, it really kind of hit home for me.
Yeah, I completely understand what you're saying about, everything being on the hush hush, and especially within the Black community, not talking about mental health. So the fact that you were able to be that light in your community and be able to bridge the gap and start having those conversations, and people looked to you to help with some of the things they were going through is so incredible. And that's amazing that you were able to make such a difference. I wanted to ask you too, kind of to go off of those things that you shared. What is the most valuable lesson you've learned about yourself being a Black physician while practicing in your field? If you can pinpoint one, but if you have multiples that you want to share, that's incredible also.
Absolutely. Okay, so what was the most valuable lesson that I learned myself being a woman of color in this field, working in mental health? I would say that the most valuable lesson that I've learned is that I am human. Working in this field, you do inherently listen to a lot of trauma, a lot of, heavy stuff on a day-to-day. And, I think just being a Black woman, there's just this complex that we have that we need to be strong and, we don't rest. We got to keep going. We got to keep pushing and pushing. And, your body is gonna stop you if you don't take rest, and I kind of start to realize that because when I transitioned to my new role and working from home, my own anxiety kind of started creeping up on me, and it was pandemic time. So on top of me sitting there and listening to what other people had going on, I was really reminded that I need to check on myself because yes, I'm in a role to provide care to other people, but how can I pour into others on a day-to-day basis when I'm not taking care of myself? So I just started becoming much more aware of it's okay to not be okay. It's okay to seek therapy, or it's okay to really practice self-care for yourself. Working in this field for me has been a very humbling experience. I work with women of color who are making 6-7 figures, who have the car, the family, the career, but they're having thoughts of wanting to kill themselves, or they have tried. And for me, it's like, wow, mental health, mental illness, it doesn't discriminate. It doesn't matter if you're white, Black, brown, yellow, purple. And it doesn't matter if you're young, old, or somewhere in between. It doesn't matter. And it can happen to anybody at any point in your life. You can go your whole life and be fine. And then something happens. And for a lot of people, it was the pandemic, and your whole life is flipped upside down. So I've learned that, like I said, was that I'm human. It's okay to rest, and that it's important to be very, very kind to yourself and to extend the same grace that you extend to your patients and to your friends and family. Extend that same grace to yourself, because you have to take care of yourself. It doesn't matter what field you work in, but especially in a field like this, you do have to make your mental health and your own self-care a priority as well.
Of course. I think what you were saying about extending grace, the same grace to yourself that you extend to your patients and your clients, that's extremely important. I think that we often forget that we do need time to rest. And what you were saying about Black women and the stigma being that we have to be strong and we have to, be the glue that holds everything together and power through our emotions. And the fact that you're breaking through those barriers and you can sit with yourself and say, that's not the case. And we do need rest. And I am human. That's great. And that's incredible. And I know that your clients I see why they look to you and I see why they do that. Dr. Alana, I wanted to ask you, have your patients or clients taught you anything that stuck with you that you'd like to share? Being that you work with kids, and I want to know, I'm sure there's a lot of lessons there.
So many. Before I share lessons from kids and parents too, just to echo what Valerie shared, going through the pandemic, as I was very early in my career. I was still on internship when the pandemic happened. So I was still learning how to be a clinician when COVID hit, and everyone was asking how to hold it together. And I was like, I didn't learn this in grad school, actually. So something that really stuck with me as you were speaking, Valerie, is something that I actually saw on social media while I was going through it, is that if you listen to your mental health when it whispers, you won't have to hear it scream. And so really emphasizing that importance of you need to be pouring back into yourself every day, and not just as a mental health care provider, but as a human living through the years that have been 2020 to 2022. But there have been many bright spots in doing this work. And so in my work with parents and caregivers in particular, as Valerie said, it's very humbling to work with families from all different walks of life. And something that I've been really privileged to witness, regardless of who I'm working with, is just the resilience of families. And so you'll see caregivers who are going through marital strife, who have their own toxic relationships with other family members, who are working, to support their family while also having a chronic illness. And they show up every week and they say, what can I be doing better as a parent? How can I be supporting my child? And they really go home and practice all of the things that we talk about. And so it's just been really remarkable to see what people can do for themselves, even while they're coping with a lot of different stressors. I will say too, that one of my greatest joys in my career is getting to work with kids who have really intense passions and are willing to share them with me once they know they can trust me. So I have learned so much about anything that kids come in and want to talk about, whether that's water safety or anime or the animation industry broadly. I will listen to them and watch them light up. And it's just a really excellent reminder about, one, how we should be encouraging that in kids and really encouraging them to explore the things that they're passionate about, even if they don't make sense to the adults, right? Like, not everything has to make perfect sense. We don't have to understand everything that a child is telling us about the New York City subway system to know, okay, this is something that you're really interested in. Tell me all about the trains, tell me all about the history of it, so that they feel like they can pursue that. And it's also a reminder to us as humans that we also have things that we are passionate about outside of our careers. Our careers are certainly one of them, but we're multidimensional people. And I know we'll be talking about social media more today, but that's certainly one of the things that drew me to social media, is that as you're kind of going through this career, as you're in training or even in early career, it's really easy laser focused on this one thing. I've got to be the best provider ever. I have to read every research article. I have to get trained in every modality. And I actually find that I'm a much better clinician during the weeks where I make sure that I'm making time to do things like read and play video games and watch shows and try new recipes and go to different restaurants, because then I show up as a full person for the family in front of me.
Yeah, exactly. I think having passions is so important. Both, like you said, working a job and then having those passions that you're doing outside of that. But you also spoke to the portion of social media, which I wanted to get into a little bit with you all and ask, what made you decide to start sharing your profession on your social media? And this is for both of you all.
Okay, so I'll start. So again, a lot of people started reaching out to me during the pandemic. They kind of got wind of, I was still in school, like Alana said, she was kind of still in the early phases. I was as well, but I kind of started dropping hints that this is what I was doing, and people started reaching out. So I had created my PH Free to Manifest just with no intentions of it growing, but just to kind of create a space or a platform where people felt comfortable coming to learn about mental health, or if they had questions about something, that they could reach out to me and kind of, learn some more things without feeling judged, or, if they were too scared to just make an appointment with someone, they can kind of just come talk to me, be that medium in between kind of thing. And what kind of started happening was I started getting some good feedback. And of course, my page kind of started evolving in terms of what my niche was or what I was doing. I kind of started getting people reaching out, women of color who wanted to become nurse practitioners or become nurses in the field. So it's kind of grown to kind of teaching nurses and nurses to be and nurse practitioners to be about what it takes and what a day in my life looks like, while also still talking about what it's like me being a Black woman dealing with anxiety and learning to balance work and life and, creating that soft life that they talk about on social media. So really kind of just showcasing the different hats that we wear as Black women, in our day-to-day, along with some mental health facts, education, some stuff is funny. And then, just kind of just putting myself out there. And the more that I did that, I started getting more opportunities like this to kind of speak more about mental health on bigger platforms. So it didn't start as anything major, but it started catching traction and people had good positive feedback to it. So I've just kind of continued to do what I was doing from the beginning and adjust along the way.
Wonderful. I would say similarly, I joined social media as really just for myself. I wasn't intending to be a person who shared a ton or tried to have a platform where I was educating, but I really looked to social media as a tool for coping when I was in graduate school. I was trying to access a system of support that I wasn't necessarily getting in person. So seeing other women of color who were getting PhDs in psychology or in other fields was a little bit harder to access. And so I turned to social media for that. And in the process, I ended up, similar to what Valerie was saying, just sharing my own experience. So I was really in the thick of doing grant research, writing articles for publication, trying to formulate my dissertation. And I thought, other people might benefit from seeing what this looks like and what the unstructured weekly life of a graduate student looks like. And so that's kind of how I started creating content on social media. And then when I moved into the later stages of my early career, it became more about sharing and uplifting the voices of the individuals that I was serving. So I would say for the last 2 years, my content, so to speak, has really just been to amplify the voices of autistic creators, specifically Black autistic creators, and other Black graduate students, so that those individuals get their content shared as well.
I love that. I feel like there's not a lot of people in that space doing that. So I love that you've kind of tapped into that space, because I'm sure there's someone out there who's looking for someone like you on social media. So I love that.
Thank you. I like to think of it as like virtual cheerleading.
That's cute.
And I think we all need that at some point or another. Like social media has become a place, it's a hub for all things that we want to know, all things that we need to know. It's a form of, like, it's a news feed. We get our news from there. We get coping mechanisms from there. Like, we look to people for advice on social media. So when social media is filled with people like you who are doing this work and you are sharing these tips for people who are looking for ways to cope with mental health and also talk about it and see that there shouldn't be a stigma surrounding it. That's really important. I know you talked a little bit about it already, Dr. Alana, but I wanted to ask Valerie if you wanted to talk a little bit about the content you're sharing, and both of you also, if you wanted to maybe highlight one of the most impactful pieces of content that you've shared and the effect that maybe had on your audience.
Okay. So, just to kind of reiterate again, the type of content that I share about mental health disorders. I talk about my journey as a nurse practitioner and what that looks like, and then just kind of incorporating my lifestyle into everything. And what I kind of realized is that social media can be a good and a bad thing, depending on how you utilize it. And I know I've heard some providers kind of complain about, oh my God, this patient came in and they swear they have ADHD. They swear they have this because TikTok told them or Instagram told them. And to me, I kind of looked at that as a good thing. I looked at it as a good thing because what I found was, because of social media, yes, people are diagnosing themselves, but it's bringing them in to come see people like me. And in that space, we're able to have a conversation and really flesh out what's really going on it may not be what you thought it was, but now you're here and now we can talk about it. So I kind of love that aspect of things. So the more feedback I get from people, I kind of try and cater my content a little bit to what I'm getting feedback from people. I'm still figuring out exactly what my style is or what delivery of information works. But, I just really love being on social media in this space. And I'm seeing more and more people kind of stepping up in this space to kind of, amplify the Black voice and to really just showcase what their niche is in the healthcare field. So I love that.
That's so awesome. As I had briefly mentioned, a lot of my content is really just sharing kind of my day-to-day experience as a grad student when I was a student and as a clinician now, and then amplifying the voices of those who belong to the communities that I serve. And I would say that I'm still trying to find my niche as far as the content I create as well. I actually kind of got into it, as I mentioned, as a source of support, but I also found that I felt most kind of creative and in flow when I was creating visual supports for families and for kids. And so I thought, I could create those for adults too. So I started with like some typography types of content where I was sharing like writing inspiration. I did just kind of photography as well. So like the aesthetics of being a graduate student who cares about like pretty copies while she's writing. But now I'm thinking, I've done a lot of visual supports as far as, identifying the overlap of symptoms when we're looking for autism spectrum disorders and how to differentiate autism from other things. And so I want to start sharing more of those types of pieces of educational content, but still in like a visually engaging way. I would say that my most impactful piece of content that I've posted thus far is probably my dissertation defense, because everyone loves to see, successful people making it out of graduate school and having a life beyond that. So I would say that's been my most impactful. And I'm really grateful that the response was really positive. And I would also agree with Valerie that there's been such an increase in the clinical space of teenagers, of families coming in and saying, I think I have autism, or I think I have ADHD because I saw all of this information on the internet. And I'm like, that's great. Let's talk about this a little bit more and see if it's, what you're experiencing is being driven by that. Because as Valerie said, sometimes it is and sometimes it isn't. But now that you're here, let's provide you some education and some tools. So I really love that social media is creating all of these real life-changing experiences for people.
I'll also say, I'm sorry, I didn't answer your question about most impactful piece. What I'll say to that is that it's hard for me to determine what my most impactful piece is, because I put out a lot of content and it hits people in such different ways. So how impactful it is, it really depends on the individual. But what I will say is that I realized when I started being a bit more authentic, a little bit more vulnerable on social media, that got a greater engagement or more response from people. And I think it was a bit scary for me to kind of do that initially, because one, I work in this field. Two, I like my privacy. And three, it's just kind of scary telling the whole world, about yourself, being a Black woman dealing with anxiety, right? Nobody expects that, So I think for me, the most impactful pieces of content that I've shared are the ones where I've kind of just spoken about my journey or been very candid about, dealing with anxiety or dealing with, losing a loved one to a mental illness or something like that. People really kind of engage with that because that's relatable to people. So I think for me, when I'm able to be more open, that those end up being the more impactful piece of content that I put out there.
Of course. Yeah. I definitely think that within social media and the space, you see a lot of people sharing, Instagram specifically, and most social media sites are a highlight reel. And a lot of people use it as such. They use it as a way to show the best parts of life. And not many people are sharing their struggles and being vulnerable. But I'm someone who I feel like when I see people who are being vulnerable, I think that's so powerful, because it reminds me, these are real life experiences, and happiness ebbs and flows. It's not a constant. And the fact that people get on social media and they're able to authentically show that, it's encouraging. And it's encouraging to, especially within the Black community, seeing other Black health professionals and other Black creators talking about those things. It allows us the ability to feel like, hey, like I can feel these emotions. They're real, they're honest, and this is me. And I can observe what's happening, and I can either, go to somebody to get help about it, or I have an outlet to talk about it and I don't have to hold it in. So the fact that you all are sharing those things is so impactful. And I think that's incredible. I wanted to ask both of you, what have you learned personally or professionally from sharing on social platforms?
I think I would say, kind of linking it back to what I had shared earlier, just the importance of being a full person. So as you said, social media really can be a highlight reel of all the best moments, but we're not just one thing. So we're not just clinicians, we're not just researchers, we're not just people who have it all together. And so I think it's the thing that I've learned is that not only is it okay, it's necessary to be fully yourself and to be multidimensional. And I feel that especially as people of color and extra especially as women of color, as you're going through graduate school and navigating medical spaces, it's really easy to fall into the trap of becoming one thing. I have to be the best at this because otherwise I'm going to be looked over for things. People are already kind of discounting me. And so I have to be the best at this one thing and I'm going to hyper focus on it. But social media has taught me that it's really important to embrace all of the parts of yourself that feel like they don't align with that, because really they do. You're a full person. And especially in the mental health space, we know that the active ingredient in care is the therapeutic relationship and the alliance. And so you could be the biggest expert in your field in something, but if there isn't that individual piece that makes families want to come in to see you, you're not going to help anyone. And so the best way to really activate that is to embrace all parts of you. And so that's the gift that social media has given me.
So for me, what I would say, I guess, in opposition to that, I've kind of learned about the ugly side of social media, and I think being more on social media and creating content more consistently, I've learned that it's very important to check in on your own mental health, what you're taking in on a constant, the type of people that you follow, the type of people that you surround yourself with is really, really important, because it's easy to kind of start comparing yourself to other people. It's easy to feel like you're not doing enough or you're not where you're supposed to be because people curate their lives based on the good times. You know what I mean? And not also on top of that, not everyone is going to like you and not everyone is going to agree with some of the things that you put out there as content. So some people can be very, very mean. I remember there was one time I got a post and someone left a really nasty comment and that really bothered me. And I'm telling my boyfriend, he's like, why are you so concerned? It's just like a person that, is somewhere in the internet space. And I was kind of like taken aback, like, wow, why am I so bothered by that? So I had to kind of take a step back and really kind of just process where I'm at and figure out why I got so triggered by a particular response. So I think being in that space kind of made me more aware of where I am with my own mental health. And then also realizing how important it is to take breaks, and not put so much pressure on yourself. This should be a fun experience. Being on social media, creating content for other people shouldn't be something that's draining you or making you feel miserable or like putting you down. It should always be fun. And if at any point in time, it's not a good experience for you, take a break, take a step back. You don't have to be completely engaged 24/7. So that's something that I learned on the flip side in terms of being on social media.
Yeah, I think those are both such great points. And Valerie, what you said about taking a break and taking a step back and kind of like checking in with yourself, I think that's so important to emphasize, because I think at this point in time, everybody is encouraged to share so much on social media, to the point where some people, share every aspect of their life and they don't take a step back. And then you see those posts of people saying that they feel so drained by social media. And I think that what you said is a good reason why sometimes we just need time to disconnect. And, people are going to be nasty on the internet. Sometimes they're not going to agree with you. And I think once you're able to kind of sit with yourself and say like, okay, but like, I'm human. This is my experience. And that's all that matters. It makes this experience on social media a lot more fulfilling. And it should be something that's fun. It should be something that you feel passionate about posting and you feel passionate about sharing because you want to make a difference in someone else's life. So I completely understand that. And I completely, I think those are both great points. I did want to ask and kind of get a little bit more into the content that you're sharing and talking about mental health. Why, Dr. Alana, why did you feel that it was important to start sharing content regarding mental health and your journey and all of the things that you mentioned.
Yeah. Well, as I started to get deeper and deeper into my area of expertise, I started to realize kind of the discrepancy between all of the facts that were floating around in my brain and what the general public really knew. And I think it's really easy to, as I said, as you're kind of moving through this space and learning more and developing your own skill set, to forget that you are spending 70 to 90% of your time learning about this. But the people who you're interacting with don't have that same level of knowledge. The people who you have involved in your personal life don't have that same level of knowledge. And then there's the general public who might have even less. And so I really felt like there had to be a way to bridge this 20-year research to practice gap that we have in a more rapid fire way. And so social media was an excellent tool, not only to disseminate, but also to learn about the lived experiences of people who are currently engaging in therapeutic services, what's not working for them, what is working for them. And so social media was just a fast track for me of a way to provide information, but also to receive information back from actual families who are receiving that care. And so that was really what drove me to start posting.
Yeah, that's amazing. Valerie, would you like to share what that process looked like for you?
Can you just repeat the question for me one more time?
Yeah, of course. Why did you feel it was important to start sharing content regarding mental health on your page?
Well, one, like I said briefly throughout my journey, just kind of starting to realize that a lot of people, one, were just not educated on the topic, or that it just wasn't really spoken about within our communities. For me, my parents are Haitian, Caribbean background, and I think mental health obviously is something that is very taboo and really not spoken about. So my entire family is in labor and delivery, and I'm the one who's in mental health. So my parents literally were like, what do you do for work? Like it got to the point where it's like, I'm a whole nurse practitioner working in the mental health field, and you guys still are asking me, what do I do for work? You still don't take kind of what I do serious. And like I said, when the pandemic happened, everybody was kind of isolated to home. My parents kind of became a bit more aware of mental health being a real thing, because they were now encountering their own friends and family dealing with some issues. And my mom herself throughout the pandemic developed really bad anxiety, and they couldn't identify it as such, but I knew that's what was happening, and one day my dad came up to me and he's like, Valerie, can I ask you a question? I'm like, sure, Dad. He's like, what's this depression thing about? Like, are people born with it? Like, what makes people want to kill themselves, And he started asking me questions, and I was like blown away, because never in a million years would I even think that my father would be capable or would want to have a conversation like that with me. So for me, like I said, I think pandemic time, because of what the world looked like for all of us, it kind of became apparent that I needed to kind of start sharing more and more information, because people were really dealing with a lot, like in great numbers all at the same time. So I felt like, because we were at home, we weren't interacting with people, social media kind of became a safe haven for a lot of people. I was in school still in the middle of all this going on. So I think coming on social media and talking about these things, a lot of people kind of found comfort in that. And as people started reaching out to me, like I said before, I kind of started putting more and more content out there. And, there wasn't a lot of people in my space that looked like me that were talking about it. Now I see there's so many more people kind of coming up and doing that. And I love that for us, because it just normalizes, the conversation. And I think that that's the first part to kind of getting people to open their eyes to mental illness and mental health, is having a conversation, platforms like this, having a conversation about it. That's the start of it all. My dad having that question to ask me just started opening up his mind to what mental health and mental illness looks like. So that's kind of why I felt it was important to start sharing on social media.
Yeah, of course. That's so beautiful that your dad, came around, and I feel like it took the pandemic for a lot of people to really look inward and say, wow, like I am struggling with this thing, or I do feel these things. But that's amazing that he felt comfortable coming to you and asking those questions, because like you said, it just takes one conversation. I wanted to kind of elaborate on that and ask you, what areas of mental health within the Black community do you feel aren't talked about enough?
Okay. So I'll start. So I think overall mental health is a very big umbrella term. So I think mental health in general needs to be spoken about more in our communities. But I guess I'll kind of speak to two areas that I see or that I deal with at work on a day-to-day. The first one is the LGBTQ community and trans community. I have a lot of patients that I see that are people of color that fall within those brackets, and it's evidence-based. They deal with higher levels of anxiety and depression being in that community because they are very much so stigmatized. And I find that they also shy away from seeking mental health services because, the stigma, and they think that, providers are going to judge them. And what I found was that when I started working with a couple of people like that, they started telling all their friends and they all started kind of coming to me. And I think that I can't say that I follow any creators or found a creator, they might be out there, that really sheds light on the mental health struggles that people within those communities face. Between dealing with body dysmorphia, becoming comfortable with their sexual orientation, going through the process of transitioning. It's a lot that goes into that and a lot that they deal with. And I would love to see more conversations be had, especially for people of color within that space about those particular topics. So that's one. And then the other topic is Black maternal mental health. That's also another very, very big one that I don't think is also spoken about enough. Being a Black woman in America and dealing with pregnancy, we are at 3 times a higher rate of pregnancy-related complications than any other race. So just within that alone, there's going to be some anxiety or a fear base that's associated alongside that. But on top of that, being a woman dealing in pregnancy, there's a lot of hormones going on. Your mental health is kind of, it can be good or it can be bad. And for a lot of people, I think they don't think about how women in pregnancy deal with anxiety, deal with, postpartum depression, postpartum psychosis, bipolar disorder. And it's a very much so a very, very big thing, and I think we spend a lot of time talking about how the baby feels, but we don't spend a lot of time talking about how the moms feel. So, that's something else that I would like to see more content or more creators kind of touching light on that.
And then I think that's a nice segue into the area that I would like to see talked a little bit more about, and that's parenting in the Black community and how to parent a child who presents as differently from maybe what your expectations are, what your sister's kids looks like, what your neighbor's kids look like. And really, I think that there's a lot of worry in Black caregivers about how do I raise my child? How do I teach them what they need to know to stay safe in a world that maybe will assume the worst of them? And what I found is that sometimes that prevents parents from doing things that are helpful for kids, especially if there is a developmental difference going on. So they worry about bringing them into a provider and talking about all the things that are hard for them. Why is my kid screaming and tantruming instead of asking for what they want? I don't want anyone to know about that, so I'm not going to tell anybody about it. And what that prevents is one, you as a parent getting the skills that you need to understand what's driving that and how to address it so that your kid can be safe. But then also what I've seen is that in a means to protect kids, parents will often take a really harsh approach to parenting, right? I've got to teach my kid that the world is tough. So in order to do that, I'm going to be tough. And while we want to give kids knowledge and skills to navigate the world, we also want to give parents and kids emotion regulation skills. And so understanding how to teach kids, it's okay to be mad about stuff. Anger is very functional, but we have to control it in a way where it doesn't end up getting our belongings or other people hurt. And so I would like for, in the Black community, some space to be open to caregivers to talk about the things that are hard for their kids without feeling shame about it.
Dr. Alana, I think that is an incredible point. And I feel like it's something that many people within the Black community can empathize with and can relate to because, just in general, a lot of parenting, you see, what you were saying, some of those like harsher tactics being used with kids, and all of this is, it's historic, and all of these things, we can't necessarily like fault ourselves entirely for these things, but they exist, and people like you who are able to bridge that gap and say like, it's important to learn these things so you know how to help your child in their development years, especially when they're dealing with things like ADHD and autism. They need more discipline, but in a way that comes from a gentle place, a place of listening and learning and being open. And I think that's so important because I think that's a problem within our community, and I've seen it, and I see on TikTok, there's this burst of more Black parents showing the benefits of gentle parenting and what that looks like, and teaching their child how to communicate openly their emotions rather than immediately shutting them down. Because I mean, we've all experienced that at some point, our feeling like our emotions have not been validated. And like I said, all of this is historic, and all of these things, there's a reason for this, but the fact that there's that unlearning happening, and there's that push for that happening, the push to show parents, hey, it doesn't have to be this way. You don't have to discipline your child this way. You can be gentle, and there can still be results happening there. So I think that is so, so incredibly important. I wanted to ask this one last question before we get into Q&A, but this is for both of you all. In what ways do you help normalize the importance of mental health? And also, Dr. Alana, what you were saying about, gentle parenting and parenting in general.
I would say that, as Valerie had alluded to before, so mental health has no discrimination, right? So everyone has their own unique challenges and experiences. And so I think it's important to share that the Black community is not exempt to that. And so in the same way that you had mentioned, Kirsten, that, we can pretend and push down our emotions, but that doesn't mean that they're not there. And so it's actually more adaptive to be talking about them more openly. And something that I talk a lot with parents is about emotion coaching, right? So when you see that your kid is having a big feeling, label it for them, help them understand what's driving it, and know that you understand why they're angry about that. Of course, we get frustrated when we don't get the things that we want. Of course, we're sad when we, have to miss our favorite activity. And here's the thing we can do to feel better and move through that. And so I think that's something that I'm really passionate about is modeling that. So when I'm in front of a parent and I'm giving them that advice and they're saying, oh, but I'm so frustrated by this, I'm like, of course you're frustrated by this. It's really hard when your kid's having a tantrum 7 times a day. So kind of modeling that skill so that they can feel what that support looks like. And then it teaches them as well how to have some language to use it with their kids. And so that's one way I try to normalize it, is by having them experience it themselves so that they can then be the teacher for their child.
And I think that I kind of normalize it, just like I said, by having conversations. I talk about mental health all throughout my day. It's woven all throughout my conversations with my friends and family, and obviously on social media. And I've also gotten to a place in my mental health journey where I can openly speak about a lot of things. And I know that it's impactful and that it helps, a lot of people out. I tell people all the time, like, therapy saved my life. Like, I go to therapy. I've been in therapy for the last 4 years. And I think that obviously it's had a lot of benefit for me, but even as a provider, I think it's made me even better of a provider, because my patients can relate, I can relate to them, and I just come off as more authentic. And I think that's what's important, is that people can feel like they can really, you understand them. They don't feel misunderstood. They feel heard. So I have no shame in when I'm telling someone, hey, I think maybe you need therapy. Hey, listen, I've done it too. It's not just I'm telling you this is what you need to do. I'm actually practicing the same things too. So I normalize it by weaving good mental health care practices throughout my day, my everyday life. And I showcase that on my social media. Again, I also showcase that I have bad days, or that, hey, today I didn't do this. I didn't go to the gym for 2 weeks straight. And that's okay. That it's going to be up and down. Like you said before, your healing process is not linear. It's a lot of ups and downs throughout that entire process. So just being candid, being honest, genuine about it, and having those conversations, to me, I think helps really normalize the conversation of mental health.
Yeah, of course. I agree. I think all of those things are great. We do have some questions that have come up in the chat. So one of the questions was, how did you land on Instagram, TikTok, and Twitter and other platforms you use to share content? So what did that look like for you?
I would say I landed on Instagram because I was an active user of Instagram. So I was consuming a lot of grad school related content. And so that felt like a natural place to start sharing as well. I also really love professional Twitter. I think that there's a lot that I've learned from other researchers. A lot of individuals who I really respect in academia were active on Twitter. And so that was a really interesting way for me to see, like, oh, the people who I admire in these clinical and research spaces are using social media as well to disseminate. So that kind of inspired me to get onto Twitter. And then I think, like a lot of the population during quarantine, I found myself on TikTok. I don't create professional professional content there, but I do consume a lot of content from actually autistic creators on TikTok. And so that's kind of how I naturally fell into those platforms. I was using them personally. And then because my personal and my professional are so intertwined together, it just felt like a natural extension.
Yeah, same for me too. I was an active user on Instagram, and I had a couple of friends who were content creators. I don't think the name was really out there like that at the time, so I didn't call them content creators, but they had a following on social media and they did a lot of like health and beauty stuff. And I kind of was just like talking to my friend about it and, saying that I kind of wanted to get into it, didn't know what I wanted to talk about, but something mental health related. And she started sharing with me a couple of pages of Black healthcare professionals. They weren't in mental health, but, in healthcare that had a following. So kind of started looking around. I was like, okay, I think this is something that I can do. And then like Alana said, kind of pandemic time, I got engulfed in TikTok. And I consume a lot of content there. It's very easy to get lost on TikTok. Very entertaining. But I try to kind of change or kind of cater my content a little bit to TikTok because I feel like I'm a bit more professional on Instagram with some of my content, and then TikTok is a little bit more, like a younger crowd or a little bit more entertaining. So I do utilize both platforms, but mostly Instagram for putting out content.
Yeah, of course. I wanted to ask, like, which one do you all prefer? Like, which is your favorite platform to share content on?
That's a hard one. Like, which one am I better at, or which one I've learned how to use better? And I would say that would be Instagram. I think I get a little overwhelmed trying to cater to multiple platforms, although I know that that's important. But I would say I like Instagram better, but TikTok has good things about it too. But again, the content is a little bit different on TikTok. So it depends on kind of, what you're utilizing it for. But for me right now, I prefer Instagram.
I would agree. My preference is Instagram right now, but that's because I use the different platforms for different things. So Instagram, I really enjoy because for me, it's more short form content. It's a great way to get out a snippet of information from a concept that might be this big and boiling it down to something this big in a really engaging way. But I will say that when I'm really thinking critically about how to kind of best serve other individuals or maybe looking at different therapeutic tools, I find myself like on Twitter doing a lot of scrolling, liking, and retweeting of content. So I think they fill two different needs for me. So Instagram's for like my quick hit of information, and Twitter's for where I go to be a little bit more pensive.
Gotcha. Yeah. I've heard similar things from people about like why they use the platforms and which ones they prefer. So some people in the chat are curious about what you all think about the general role of social media itself, especially with kids and young adults in terms of mental health.
I think, like I said before, social media can be a good and a bad thing, depending on how you utilize it. I think that kids and young adults are very impressionable. So I think that there needs to be a limited use or some boundaries kind of set in place for the use of social media, because obviously there's been much higher risk of suicide and depression and anxiety amongst our young people. And I think social media has a lot to do with that because, there's just a lot of that perfection being curated on there and people trying to live lives that they aren't even quite yet ready to live. And they're seeing all this stuff and it looks so amazing and they're kind of getting their own head about it and beating themselves up about it. I think it can be detrimental if not used appropriately, and you don't know what kind of content they're consuming or maybe who's reaching out to them. And it's a lot going on. The internet can be a very scary place. I tell my patients that all the time. The internet is a very scary place. So I think in regards to our young people, I think there needs to be some kind of moderation or some type of, limits kind of put in place, because it's definitely a lot to be exposed to out there and it's going to have an impact on their mental health for sure.
Mm-hmm. Definitely. As Valerie mentioned, I always talk to families about having open communication with their children about their social media use. And it's important for parents to know kind of what's out there. I know it can be really hard because there's new things popping up all the time and social media is kind of cyclical. But I think that's something that we want to think about with social media is like treat it like any other media, right? Like you wouldn't let your kids be unattended, watching any movie at the movie theater or watching anything on the television. And so you want to set some limits around what goes through their phone as well. But also providing some education as to why it's a safety concern. So, explaining why it's helpful to have a private account and why you shouldn't be using your last name if you're a minor on the internet for safety purposes, and just setting up some clear boundaries about what is okay and what's not okay. And again, it really is important to set the foundation where you have a relationship with your child where they feel okay talking to you about, maybe something scary popped up on their social media and they want to talk to you about it. So you really want to cultivate a relationship where they feel like, my parents aren't going to be upset with me if I bring this to them. But I think it is important, as Valerie said, to set some limits around how much you're using it, how many people have access to you and your content, and just having open conversations about things you see that maybe make you uncomfortable.
Of course, what you said, Dr. Alana, about, limits, and also Valerie, you said the same thing, there being a balance. I think that like younger and younger, like children are getting on social media like at younger ages now. And so what you were saying about having like open conversations with parents and saying, hey, like, this is what's happening this is what I saw on my social media. This is, what I'm engaging with. I think that is very important because like younger people are getting on these social platforms and they're consuming content from everywhere, on TikTok, and you see these social media sites putting guidelines in place and kind of like deleting content if it's from a minor and all of those things to try and keep children safe. But there still can be gaps there. And I think that sometimes that can fall on the parents kind of having those conversations and helping to keep their children safe. But then on the flip side of what Valerie was saying about like just in general of what you're consuming and how it can really mess with your mental health when you're comparing yourself to a lifestyle someone else has that you want and you don't feel like you're there yet, and it makes you sad. It makes you feel like you're a failure. And as a content creator myself, I've felt those feelings before, comparing my situation, my life situation with someone else's who I don't know what they went through to get to where they're at, but I'm comparing what I'm seeing. I'm comparing that highlight reel to myself, and that can be very harmful. So having those conversations and reminding people that, hey, everyone's journey is different, and not everybody is sharing every aspect of their life on social media, and we have to come to terms with who we are. And as long as we feel solidified in who we are and what we're doing, then social media can be a positive place where we're learning and we're taking things from, opposed to being a negative place that makes us feel lower, makes us feel worse about ourselves. So I see and completely understand exactly what each of you all were saying. And I think that that's very helpful in navigating the social space in general. So I guess one of the last questions I wanted to ask you all is, do you think you'll be on social media long term? Do you see this being something that is going to be a part of your life forever, and a place where you'll continue to share those nuggets of information for people to learn from you?
I would say I hope so. I think that we are, as being early in our career, we're kind of in this unique space where social media has existed for a really long time, but the way that it's looked has changed a lot. And so I think that in some way I'll probably be doing social media long term, but it may not always be on Instagram or Twitter. Maybe I'll start creating content on TikTok professionally. But I think that as long as we need a tool to provide individuals with information much more quickly than universities can publish articles, then yes, we will need a dissemination tool. And as long as people are still engaging with social media in the way that they are currently, and that's the way to get a big audience to hear the things that you have to say, then yes. But if those things change where all of a sudden everyone's got access to information from a different platform, or maybe people stop using social media in the way they do now, we'll simply find a different dissemination tool.
Well said. Agreed.
Yeah, I think obviously social media is evolving, and more people are getting opportunities through social media, with TikTok and viral content. People's lives have changed overnight. And I think as long as that exists, there will be a need for content creators. There will be a need for influencers, in a sense. There will be a need for all of that because the demand is there right now. And as long as more information is happening, as long as things are changing in the world, people will have something to say. And we need people like you all, voices who can echo the things that need to get out into our community. There's going to be a need for that, because I think this is kind of like a revolution of unlearning. And you see a lot of us trying to unlearn things that we felt maybe held us back in our families before us. And all of that's so important. And people like you are doing the work to help us unlearn and help us pivot and really propel our lives forward and start doing good work and changing the way that the Black community sees mental health, changing the way that the Black community parents, all of those things, but doing it in a positive light and changing the way that those things go. So I 100% agree. And I just wanted to thank you all again for being a part of this conversation, everything that you said. I know people were resonating with it in the chat. I just wanted to thank you all for the work that you're doing, both in your profession, outside of it, on social media. And thank you for this conversation.
Thank you for
Thank
having
you so much.
So everyone, just as a reminder, this will be live on YouTube. So you'll be able to share this conversation with friends, family, whoever you want to kind of get into this conversation and share with them. So that will be available for you there. So thank you all again for joining, everyone who joined online to watch. And thank you, Dr. Alana and Valerie, for being a part of such an incredible conversation.